As we await participants joining in, I'd like to request us to do a short icebreaker. So maybe if we can all log on to www.menti.com. Let me put in the chat box. Menti.com, and the code is 5104784. I'll put it in the chat box. Yeah, there I can see we have November 2002, 33%, and 2019, 67. I suggest I'll give you a clue. Just read the question really carefully. It's SARS-CoV-1 and not SARS-CoV-2. So maybe you can have another opportunity to readjust your answers. Yeah, I see 5 people logging in. Let's have more of us log in. www.menti.com, and the code is 5104784. Yes, the November 2002 is the correct answer. It was first discovered in southern China in November 2002. That was the first case of SARS-CoV-1. SARS-CoV-2 again was found in first discovered in December 2019. I see someone has put February 2007. No. Yeah, no. The correct answer is November 2002. For those joining us, kindly go on to menti.com and use the code that's displayed at the top of the screen, 5104784. Maybe we can give it another 2 minutes before we proceed. let's move on to the second mentee. So if we can start answering that, what aspect of your life has been most affected by the COVID-19 pandemic? You can drop in your answers. Absolutely, absolutely. Education, I think, has been one of the major things that have changed. Safe spaces to study in. Yeah, yeah. Education. It's brought about a really different dynamic to the whole education setup, moving away from the classrooms, physical learning. I know we all miss physical learning, but it's unprecedented times. It's unique times, and we must adjust in order to stay safe. I mean, health is wealth. So as long as we're safe and we continue our learning, let's embrace the new normal and work around it. Mental health, absolutely yes. That's also one area in during this time that's really been affected. Personal space. Is it probably because of staying home too much around the family that you've lost your personal space? Maybe one of whoever is interested can raise the hand and I can unmute you and maybe you can explain. Okay, Kevin. Yes. Kevin, can you hear us?
Yes, sorry for raising my hand.
Oh, all right. Maybe you can say something now that you're raised already on.
I just got in. Let
All
me
right.
get the yeah.
Okay. All right. No worries. Mental health, yes. Physical health and fitness. Yeah, I'm sure gyms are all closed. But now, recently, I was hearing gyms have started opening and they're regularly fumigating and stuff. I don't know if you've heard of that as well. Social aspect. I can't go to urban centers or meet friends as much as I'd like or used to. I know. I'm sure that's been a really major aspect that's really put us down.
He is unpacked.
Travel.
Okay.
It's the first time. Sorry, is someone talking? Yeah, travel. It's the first time that we've seen international travel being has come to a standstill. But yeah, like mentioned before, health is wealth. So let's put health first. It's unprecedented times. Let's overcome it stronger. And then once things are in place, then of course we can travel around and enjoy what the world has to offer. Yes. Anything else? I see we have 23 and only 9 are logged in. For those of us joining us, kindly go to menti.com and use the code 5104784. All right, I think we can now begin. Perfect. Just a minute as I just set up. Okay. Hello, everyone, and welcome to the MSAKE General Assembly 2020 Open Access Session 2 on Pandemic Preparedness. I would like to begin by honoring and thanking our panelists for taking time off their busy schedules in order to be here with us today and engage with future healthcare professionals of the country. May request the panelists to kindly switch on their cameras so our attendees can see them while I introduce you. Yeah, Professor Anzala.
Yes, I've been listening. Are we ready to start?
Yes, Prof. We are. I'm just doing the intro and then we can begin.
Okay.
Hello, Dr. Ubrin.
Okay, just go
Prof,
ahead.
if you can kindly switch on your camera so our audience can see you.
Okay, go ahead.
All right, perfect. Okay, yeah. So with us today, we have a dynamic team of panelists, beginning with Professor Anzala, a gentleman many of us have seen on television during the presidential COVID-19 briefings. He is the director at Kavi Institute of Clinical Research and a senior professor at the Medical Microbiology Department at the University of Nairobi. Also with us today, we have Dr. Ubrin Mora Gashemba, who is a consultant physician and a health advocate. Also in attendance, we have the honor of having Ms. Evelyn Carijo, who is the project coordinator of Youth in Action at AMREF and a youth leadership advocate. We also have Dr. Mary Claire, who is the coordinator of the KMA Young Doctors Network Mental Health Committee. She is a MSAKE alumni who served as a Secretary General and is also the co-founder of Respect and other student-led bodies. And lastly, we have the chairman of the Kenya Healthcare Federation, Dr. Amitaka, who is not with us right now, but will be joining us shortly as we proceed. I know our attendees are very excited for this session, so without wasting much time, let's get to the agenda of today's session. The theme for this year's GA is Youth for Universal Healthcare in Pandemics and Beyond. And today, we shall be tackling the topic Pandemic Preparedness. Kindly note, if you have any questions for the panelists, feel free to post them in the Q&A section and they will be answered at the end of the session. If you wish to speak, kindly raise your hand and we shall unmute you and you can ask the question to the panelists. Thank you. Yes, so we can begin. So the COVID-19 pandemic is now recognized as one of the most tempting challenges and the largest tragedy of the century after the Second World War. A novel respiratory disease that was reported in late December 2019 in Wuhan, China, was first considered an ordinary flu, which then spread across the world in weeks and months to be labeled as a global pandemic called COVID-19. The word COVID-19 stands for Coronavirus Disease 2019 and is underlined by the WHO as a public health emergency that causes an infectious respiratory illness. Throughout this unprecedented time, we have seen a big shift in our daily lives. With the wearing of face masks as soon as you step out of the house, to the traditional handshakes becoming fist bumps, to weddings taking place with less than 20 people, COVID introduced a different aspect to life, which is now considered the new normal. The new normal forced us to change our way of education, where learning transformed from the conventional classroom to the online space. A change that was considered a challenge soon turned to be the safest and most practical way of learning. With now what is termed a second wave, it is high time we take personal responsibility and practice safety and hygiene, not just for ourselves, but for our loved ones and our healthcare providers. On to our first point of discussion today to all panelists is, what has your experience been like in this pandemic? May I kindly ask Professor Anzala, who can start by reviewing the burden of COVID within the country and the world at large, and he can shed light on what his experiences have been like during these times. Prof?
Yeah, thank you for the invite. And it's interesting to be talking about COVID at this point in time. I think we have, as a virologist, immunologist, have always known about coronaviruses. We have always taught about coronaviruses at the universities. but it never really occurred to us that coronavirus would be a problem as it is today. Even when the first case was announced in China, there was very little that the international community expected that it would actually grow and become a problem that it is. We take cue from the SARS-CoV-1 in 2002, 2003, which never really went beyond China and Japan. And that particular outbreak actually just died out. It never really became global. So and then 2013, 2014, we had MSAKE, the Mediterranean one, that again just has remained within the Middle East and northeastern part of Kenya, and I believe in Ethiopia and Somalia as well, because it seems now to be endemic among camels. And again, it has remained quiet, and within those regions, a bit of work we've done in northeastern, maybe 70 to 80% of those camels show serological positivity to MSAKE, but very few humans show serological positivity. So it is interesting how these coronaviruses are behaving. We are yet to really understand why SARS-CoV-2 got out of hand. I will not really dwell on the numbers because it's a moving target. Today, I might say this, but we have seen the countries that have been ravaged the most: the US, Italy, Spain, and now Britain. And there's another resurgence. I don't know whether I should call it a second wave because I don't understand what a second wave is. As an immunologist, virologist, I call it a resurgence or a spike, because a second wave would have other meaning that I may not completely understand. So we are still in this problem. COVID is going to be with us, for a while. My fear is that it might end up being endemic. And my fear is also that it might end up just being like influenza, maybe keep changing, but we might require yearly vaccinations. I hope that will not come true, but just from the understanding of the immunology and the way it is behaving now, that might be the direction we are taking. I'm afraid to say that the measures that we had put in place and the measures that we advised government to put in place, and which they did very nicely in April and May and June, worked very well. But something has happened from August to now that fatigue has set in, not only in the general community, but also even among the healthcare workers. So, and we have just gone back to life as normal. But I'd like to say here and now that things might not look normal, but ladies and gentlemen, things are not normal. Things have changed. And let me also put this forward that initially we had said that those who are dying are those with comorbidities, those who are old. That may not be the case as we look at the Kenyan situation and the world over. And we don't have a clear indication as who will survive, who will develop severe disease, and who will die. And then now COVID has also compounded the problem of HIV/AIDS. Nobody seems to be talking about HIV/AIDS, but ladies and gentlemen, HIV/AIDS has not gone anywhere. It is still here, it is still infecting, it is still killing people. So as we speak, we have a twin epidemic. And the worst bit of COVID is that COVID has also compounded socioeconomic issues. We are not the way we were before. You can't hug, you can't kiss, you can't shake your hands, you are told to stay away. But we are creatures of habit. This is how we are socialized. We are socialized to hug, to kiss, to hold, to work together, but we are being told, stay away. So we are in a catch-22, ladies and gentlemen. So, let me stop there, but we will revisit again when I come back and talk about the measures that have been put in place and maybe discuss further why are we failing. But the whole issue is that we are creatures of habit. When we are told do this, we hope to do it for a short time and go back to normal. And this is a problem across the board. So that is, the current situation. Over and thank you.
Thank you for that, Prof. On to you, Dr. Mura. What has your experience been like during this pandemic?
Thank you so much for having us. I think a lot of after you speak after Prof, it's like he's already said everything. But my own experience from this pandemic as a clinician in the front line has been both enlightening and also disappointing in the same way. I think Prof has already alluded to the fact that we are unlearning things that we have been cultured to practice every day and behave in a particular way. But for me, what strikes out the most is how the underbelly of our health system has been exposed and the weaknesses that exist. And we knew that they existed, but now they're being emphasized on how we should seize this opportunity to strengthen our health systems. And as health workers, my own experience has been how Prof has already mentioned how the lethargy and the inertia is across everyone, every human, every citizen. It's not just only in the Kenyan lay people, but even the health workers have loosened their grip and their guard is down during this, what would actually call a resurgence and not a second wave, and how human behavior really affects health. So a lot of things have come out for me on how human behavior is something that really, I guess we need to do more studies around that and how we respond to pandemics. But Prof has really brought out a very important aspect of how, as Africans and as people who are living in the developing country, we should have learned better. We should have responded better because we have been existing with the HIV pandemic and other silent pandemics like the pandemics around cardiovascular disease, which is something that is close to me. And unfortunately, having the strength that we've experienced the HIV pandemic and we've put systems in place that have really worked for our patients, we should have been teaching the rest of the world on how to respond to pandemics. But unfortunately, we are still waiting to learn from them. So as young people and as we talk to young people today, it's something that we should take as a challenge where we learn from the experiences we have, and when we are called upon, because we are the authority in this regard, we should be able, sorry about that, we should be able to respond appropriately, because we have the experience. And as we said, the HIV framework of control and what has been put in place should have really worked well for us, even in behavioral terms. But unfortunately, that has not been the case. But just to emphasize that our country and national preparedness has been put at question. We have, I know Prof and the rest of the team in the task force has really tried to advise the government appropriately. But again, as they say, the government will say this or the experts will say this, but we need public trust, which has been a big challenge for the whole team. And a big challenge for the country where we lack public trust. So the participation of the public has really not been as satisfactory as expected. So for me as a clinician, a lot of thoughts, a lot of mind-boggling things that go through my head. And as a health advocate, I know a lot of the challenges that we've been ignoring for the longest time have come out, and it's time that we faced those challenges and address them. And for you, the young people, I think it's time that we learn from our mistakes instead of waiting to be part of the statistics. Thank you, Hamza.
Thank you. Thank you for that, Doc. I definitely do agree with you and with Prof that there has been a lot of lethargy, and the young people are the ones that are going out and they're the ones bringing it home. So now on to our next panelist, Miss Evelyn, as a leader of youth movements in the country, what has your experience been like in this pandemic?
Thank you, Hamza. Really great insights from Prof and Daktari, and I want to echo what they've talked about. Really, my experience with the pandemic has not been very different from them. And from a youth advocacy perspective, as someone who's leading youth movements, COVID-19, just like for anyone else, this has been, a curveball that no one anticipated, and it's really disrupted every aspect of our lives. But what's sad is that even before the onset of this crisis, when you look at young people, our health and our socioeconomic status was still wanting before COVID-19. And now what this has done is that the pandemic has exacerbated the status of young people when it comes to health. When you look at HIV incidents, for example, I know Prof has mentioned this, even before the pandemic, we used to have like more than 50% of the new incidences being experienced amongst adolescents and youth. Right now with COVID-19, no one has looked at the statistics, but I can assure you in the next few years, as we are carrying out the next survey, things are not going to be good. When we look at issues of teenage pregnancies, for example, before COVID, it was 1 in every 3 girls getting pregnant by the age of 18. Right now, with the movement restriction, with the lockdown, with increased cases of sexual and gender-based violence, we are seeing increased, or rather reported increases of teenage pregnancies. These are yet to be confirmed. So really COVID-19 has made things worse, if you asked me. And even the United Nations really shows that young people are the most affected right now when it comes to health and our socioeconomic status. And I just want to mention also a study that we did with young people just when COVID-19 had struck around April and May. And we sampled quite a number of youth. We got responses from over 2,000 young people across Kenya. And what we realized is that the issue of mental health, which I mentioned on the Menti exercise, was actually affecting many people. By that time, we were less than 2 months into the pandemic, but those who responded to a survey, we saw that over 30% of them were dealing with stress, were dealing with anxiety. They didn't know who to speak to. They were seeing their friends and families less. Even with the digital platforms, it's still not the same. And I know Prof alluded to this. Most of them indicated that they had lost jobs, over 50% of them. And what that meant was that they had to forego many things, including access to health, to routine health services that would ideally go to, to obtain from health facilities if they had income. So most of them who are on basic drugs had to forego that just because they had to prioritize between putting a meal on the table and having to go to a health facility. So really the effects of COVID-19 are being felt very much by amongst the young people. And from a youth advocacy perspective, it's not just all gloom. We've also seen positive things amongst the young people. We've seen youth advocates, we've seen health workers rising to the occasion, really having their voices heard during this time. What I'm really, really proud of is actually seeing how the health workers, including students, have really taken up the challenge to contribute to ensuring that the communities and the health systems are able to respond to this pandemic. You saw your colleagues being able to innovate the TIBA vent, which was the first mechanical ventilator being innovated in East Africa. That was done by medical students. So we've really seen young people coming out to take up the challenge and to respond to the pandemic. We've seen many of them, doctors in the informal settlements, reaching out to young people, providing services, ensuring that they spread messages of behavior change and awareness creation. So there's also the positive side, because young people are not just sitting to wait for COVID-19 to affect us negatively. We've seen youth rising to the challenge and really putting out that as young people, we can take control of what's happening and we can make a difference in trying to control the spread of the pandemic. Now, one of the things that I want to mention is that as a society, as policymakers, there's still a lot that we need to do when it comes to involving young people, and we're going to speak about this later. But I just want to mention that acknowledging that the youth have a key role to play in the spread of this pandemic, and also stop the spread of the pandemic. Over.
Thank you. Thank you so much for that, Ms. Evelyn. We can now move on to Dr. Mary Claire.
Thank you, Hamza, for the question, and thank you to my lovely panelists for your great insights. I think for me, based on where we are at, the coronavirus pandemic has really highlighted one of two things. I'll put it in perspective that in medical school, we used to be told diseases don't read textbooks, and this is a classic example of that. Being a junior doctor during this past, from last year till now, I've been an intern in Kiambu County, and you would during your internship, the essence is for you to more or less get apply your what you've learned in school in your clinical practice. And this past year, they introduced 2 new rotations, which was community health and psychiatry. And that was a positive step by the medical board, because now more than ever with the coronavirus pandemic, we've gotten to see the relevance of community health and the relevance of psychiatry in internship, because we've dealt with quite a number of cases we've gotten to see a lot of cases of mental health illness, a lot of depression cases, especially university students who they're chosen to go to the university. They are probably anticipated to have graduated this year. Probably they are the firstborn and they are the breadwinners in their respective families. And then all of a sudden you have this pandemic, which has sort of left you with an indefinite holiday, and you don't know when you really go back to school to finish your education and go to the next step. And then now with regards to like community health, you've seen now the importance of primary healthcare now more than ever, because when you're doing your community health rotation in school, you learn a lot of the theoretical concepts, but now going down into community level, you find that like during the coronavirus pandemic, some hospitals shut down their clinics, their MOPCs, and follow-up of patients was really hard. And like in my facility, we had an increase in the number of patients coming because we were still running our clinics at a limited capacity. And you find people, their hypertension is not well controlled, their diabetes is not well controlled, just because they did not have access to their doctor for their clinics. And this really now pushes you to think out of the box and shows you that there's a gap in healthcare. And we as youth probably should think of more innovative ways of getting healthcare down to community level, back to where the neighbor or the person next to you. As Ms. Karijo has mentioned, we've had the TIBA event. We've also had Wheels for Life, which was started by a registrar, Dr. Jemima Karaoke, who it started as an idea with her going to visit mothers to see how they are doing for their maternal child health clinics. And now it's an app which is enabling mothers get to the hospital when they are in labor. So this also challenges us as youth to think of ways of improving our health systems. Yeah, thank you.
Thank you. Thank you so much for that, Doc. On to our next question. What have been the lessons learned from the COVID-19 pandemic that can aid in future pandemics? I will ask Professor Nzala to just slightly dwell on this. Lessons learned from the COVID-19 pandemic.
Thank you. Thank you, Hamza, and it's good to hear what the other panelists have actually been saying. You see, part of the whole issue is surveillance. Actually, just to remind the audience is that people forget that HIV is a zoonotic. meaning that HIV also is a spillover infection from the wild. It has been with us for a long time, so people forget that that was actually the origin, that some time back HIV moved from the chimpanzees and the non-human primates into humans and started spreading in humans, human-to-human transmission. And there are a multitude of infections in the wild that have that capacity to spill over into humans. So really what we must do, and this is what we've been discussing at the ministry level, we need to set up surveillance sites across the region, not only in Kenya, but across the region. Surveillance sites where we monitor fever, where we monitor infections, where we also monitor what is going on in the wild. When you begin to see animals dying, that must be our worry, because something is killing those animals, and most often than not, it is always in infections. So the urge is to look at the East African region, set up surveillance sites in Kenya, surveillance sites in Uganda, Tanzania, Rwanda, Burundi, as well as DRC Congo, because what COVID has taught us is that an infection in Congo now can be in Kenya within less than 24 hours. And those surveillance sites must be on a daily basis, just monitoring that. I'll give you another example. We have started One Health, and what I'm talking about is One Health. One Health is a phenomenon of where multidisciplinary professionals come together, some from the veterinary side, some from the human side, and some who are just pure scientists to understand the human-animal interaction. Because a lot of these infections come from the wild, some even just domestic animals. As we speak, we have a site in Taita where we have been monitoring infections. And I can tell you now that there is actually more dengue in the coastal region than malaria. And then the ecology is changing. So part of that One Health is to also begin to look at the ecology and to begin to understand climate change and the vectors and all these aspects, so that we begin to put in place what we call epidemic preparedness. And that preparedness needs a whole host of professionals, including social scientists, people from veterinary, economists, all these aspects, because you can actually see that COVID has touched each and every sector of our own way of, of life. Because what you are affecting in the wild will eventually reach humans, but it might reach humans not from the point of view of infection, but from the point of view of food security. I'll give you an example. We are working with Kenya Wildlife Service. We are working with the museums of Kenya. We now know that there's a virus that is devastating bees. So somebody might say, oh, why should we be worried about bees? Ladies and gentlemen, bees are the biggest pollinators of crops. So when you begin to see a decline in bee population, then it means you are heading towards food, issues of food security. And that's where One Health, really comes in. So that One Health we are doing, we are not only looking at infections that can spread from animal to human, but also from human to animal, but also issues to do with food security, because all these things are actually within the same basket. So we are urging government to set up surveillance sites that bring all these professionals together to look at all these aspects, including climate change that Africa doesn't seem to be talking about much. But I think that Africa, the climate change is there, it is taking place. We are beginning to see mosquitoes in places where there were no mosquitoes before. About 3-4 years ago, there was an outbreak of chikungunya, I think either in Garissa. There was an outbreak of chikungunya in Garissa. And the question was, are there the right vectors in Garissa? Were they there before? So has there been change such that the vectors that transmit chikungunya are now in Garissa? And what will happen actually next? So we need to have all this in place because pandemics and outbreaks are not over. The other aspect of it is also to even just look at the common infections that occur on a regular basis. We have had recurrent outbreaks of cholera. People have died of cholera. And when you begin to see regular outbreaks of cholera, it is also telling you that chances are that that bacteria is beginning to change and maybe adapt and become more virulent and become more infectious. So these are the issues that we must be thinking of as Kenyans, because the outbreaks of cholera has actually killed people in this country. But we say, oh, cholera, then it ends there. Oh, cholera, then it ends there. But what is happening? Why is it more frequent? What is it that is changing in the environment that is making cholera more frequent? And then cholera leads you to the discussion about food safety. How are we handling our food? How are we treating our sewage? So all these things are things under one head. So we should never leave anything unturned, because those are the things that simmer on and end up becoming a problem in the future. So One Health is a way to go. You'll hear more about One Health because we are bringing East African countries together to actually put up a big program that will bring all these things together: climate change, food security, the veterinary science, human science, social science, to really understand what is going on. And again, wildlife is now a commercial entity. So when wildlife is a commercial entity, people are selling wildlife for all manners of things. How do we ensure that as we deal with wildlife, we deal with wildlife safely, to keep the animals safe, but to keep us ourselves very safe? So all this is actually critical. And entangled in all that is a whole issue of the ecology and the changing climate. Thank you.
Thank you so much for that, Prof. Definitely, One Health is the right approach because so many diseases are coming from interaction of humans and animals. An example is the wet market in China. How many diseases originate from there as a result of the wet market, as a result of the trade of those animals that are with which humans have interaction? So definitely a really important point in tackling the pandemic preparedness and response. If we can mitigate that, you're able to prevent a pandemic of such or a disease of such from originating. Thank you so much for that. Okay, on to our next question. The entire world population currently faces enormous challenges due to the impact of COVID-19, and it is imperative to analyze this aspect. For a developing country like ours, what are the major potential impacts posed by the pandemic? If I may ask Dr. Mora to kindly shed some light on this.
Thank you. I think already Prof has alluded to some of those things, and he's put it very correctly that this pandemic and a lot of pandemics we've experienced in the past, including the HIV pandemic, that we sort of put it on the side and thought, really, there are people handling that, is that everything in this society we live in this world is intertwined. From the economics to agriculture to education, water and sanitation, employment, all those things are intertwined. And those are the same way that they have a bidirectional relationship in terms of one being social determinants of health, because they will affect the health-seeking behavior of the population. But again, because health is also part of the interplay of all these things, including their reproductive health and all those issues, and this will then have a direct impact on each other. So when one side is affected, the other one will definitely be affected in a equal proportional way. So the impact of this pandemic to our country really, it goes without saying. We have witnessed it, we are seeing it, everyone is complaining. And it boils down to that question where we ask, and one time I was saddened, just near where I live, I was just taking a walk. And then I meet this young mother holding her 2 kids side by side, and she had some bags she's carrying on her head, and her mask was just dirty and it was down. And because I'm very passionate about how people use the mask, because of the delicacy, I mean, the delicateness, sorry, of using the mask correctly and actually using the mask to spread the infection. I asked this lady, why are you wearing your mask this way? So she tells me, this is the only mask I have, doc. I mean, it's someone I know because she works nearby. She told me it's the only mask I have, and I can't get another one. So I have to buy one and use it the whole time. So how will I buy masks every day while I'm looking for food to put on the table for my children? But remember, this pandemic has also made her lose her income, because now she's coming fewer times to come and clean, so she makes less. So as I'm trying to demonstrate how the pandemic and the effects of the pandemic are just related, and it boils down to social determinants of health. So here's a lady who we all just keep on emphasizing, wear your mask, but she can't afford the mask, or she can't afford the soap to wash the cloth mask. But again, she's depending on this economy that is really shrinking down to get money, but her employer is reducing the number of days she has to work. For the audience, what am I trying to say? What I'm trying to say is that health is at the center of it all. And I think as you all grow into this thing we love called medicine, you should always remember that when you see a patient ahead of you, or when you're examining a patient, it's not a disease you're seeking. You're looking at someone who is affected by a multifaceted social determinants that will determine whether their disease is cured, a pandemic is contained, or they get food to be well nourished or nutritionally correct, so that they don't get NCDs, or they actually have education to be aware that what are the measures they need to put into place to avoid getting cancer or to catch it early. So this pandemic has just reminded everyone that for the longest time we've been ignoring health, but really it's always about health. And that's a big lesson for me that I think even people used to just think when Prof. Anzala and the rest of my senior esteemed teachers would stand in front and say, this doctor strike has to end. We need to find solutions because the services we offer cannot be compromised. Now, this is the time people should realize that that is a fact, it is a truth. And I hope the correct ears can hear that and take health more seriously. And these lessons that we are all learning as citizenry, as Kenyans, as even medical students, as doctors, as clinicians, what we are learning at this point is that the way that these things are intertwined, it's time that even in our own curriculum, we teach our younger colleagues to learn that the economics of health affect how health is delivered. So maybe we need to revise our curriculums to make sure even communication. And we've seen a lot of our colleagues really getting very stressed out. And I'm so happy that Dr. Marie said that they are now doing a rotation in psychiatry, because mental health has also come out very strongly. And it's something that we never really got to appreciate in the past, but now we are realizing that who is really taking care of the carer? Me as the provider, as Dr. Mora, who do I go to debrief to? The other time, all of us were really in mourning when we lost a lot of our colleagues in a very short span of time. How do we cope? How do we debrief in such situations? So it's really bringing out pertinent issues that we never really gave a second thought. But right now we think beyond just affecting policy, it will also affect how our education, our medical education is delivered. And I'm very sure that the senior colleague like Prof. Anzala and my other senior colleagues will definitely, this is something that is a conversation that is beyond ministry level, and I'm sure it's involving 2 ministries, and it goes in a very broad way that we are learning from this pandemic. Thank you.
Thank you so much for that, Prof. Doc, just to highlight on the aspect of the lady who was cleaning, that is a real problem that's happening. Do you spend 50 shillings on a mask, or do you spend 50 shillings to buy some skooma and put on the table? That's really a big question that we tend to overlook, but it's a real problem out there. Even measures like shutting down the country. We can't really shut down the country today and say, okay, we're in a complete lockdown. because people need to put food on the table. People are earning their jobs, which with the pandemic came to a standstill. So these are really important things that we really need to take in mind. And yeah, thank you so much for that. Um, okay, on to Miss Evelyn. A pandemic can spread to every corner of the world. Hence, every country must be prepared for such a global event. How can we strengthen collaboration between different stakeholders?
Thank you, Hamza. And I really love the perspectives of this panel, very diverse panel. What Prof was talking about, the pandemics are not yet over. We need the One Health movement. What Dr. has talked about, social determinants of health. And I agree with you that we need a multi-sectoral approach if we have to build back, if we have to strengthen our health systems, if we have to ensure that have a really big role to play in all this. One, because of our population, we are 1.2 billion strong across the world. In Kenya right now, 75% of the population is aged below 35. As medical students, you're all in the youth age bracket. But most times, young people are always left on the margins, of policy-making processes, of decision-making. When it comes to decisions about our health systems, the youth are rarely involved. So this is something that has to change. We need to acknowledge the power that young people bring to the table. We need to ensure that they're really included in this conversation. Now, one of the things that we need to do is to try and partner with young people in ways that the youth can resonate with. So, of course, looking at communication channels that young people can resonate with. And I like what your fellow colleagues, the Daktari wa Mtaa, Janet Githinji, really does, connecting with youth wherever they are, trying to speak in their language. And even this time of the pandemic, she's done a really great job of ensuring that the youth are involved in behavior change communication, in trying to advocate for the needs even of healthcare workers. So really speaking through channels that young people can understand is one of them. And then, of course, looking at the most disadvantaged and marginalized youth in our communities. Most times they're left behind. We always work when it comes to building stakeholders and partnerships. We work with the elites. We work with young people in urban areas. We work with the people who are most educated. We don't think about those who are left in the margins of our society. So it's really up to us to always speak for those who cannot speak for themselves and ensure that they are involved in this conversation of helping to stop the spread of the pandemic. And then, of course, I always say that as young people, most times, in as much as we are involved as partners, most times the government and everyone involves us, it becomes like tokenism. We're just ticking a box that we have a young person in the COVID-19 pandemic response committee, box ticked. We have a young person of the CAS, box ticked. But then people really don't look at do the views and needs of young people across the entire population, are they being represented in these decision-making bodies? So when it comes to building partnerships, bringing on board all stakeholders, I always say for the youth, it shouldn't be about tokenism. We shouldn't see young people as just victims. We need to make sure and acknowledge that youth are being seen as equal partners in all processes. So the same case should apply with COVID-19 and with the process of ensuring that we build back better and that we recover from this pandemic. Then, of course, the other thing is on accountability. You've seen what's happening right now with the COVID-19 resources, the donations that we've been receiving, for example, from Jack Ma. You've seen what happened with KEMSA. People are not talking about these issues, but transparency has to be a key priority if we have to build back better, if we have to ensure that as we anticipate second wave, that we're able to deal with this. Transparency, accountability, that has to be a priority, and it has to be a key tenet of ensuring that we create effective partnerships. Otherwise, people lose trust in the systems. We lose trust in, the policy-making bodies that have been put in place. So in short, ensuring that youth are being viewed as partners, ensuring that we work and identify with the communication channels of young people, then of course, transparency and accountability. Over.
Thank you. Thank you so much for that. Transparency and accountability. Something I know we have a lot of panelists here, but it's something we really need to think about. Where did all those PPEs go? Where? But anyway, that's a conversation for another time. Okay, so on to our next question. The COVID-19 challenges and needs required health systems to rapidly redesign the delivery of care model. We saw an introduction to telehealth that allowed patients to seek consultation through a video call. What is the medical and public health infrastructure to cope with the pandemic like within the country? How is it transforming? I'd like to ask Dr. Moraa and Dr. Mary Claire to shed light upon this, please.
Maybe I can start and then
yes. Sure.
Yeah. So telemedicine, as it's known, it's something that even before we had the pandemic, this COVID pandemic, not the pandemic, because we already had previous pandemic. We have seen other nations really embrace it much. The only challenge that they kept on reporting in a lot of data that comes from those areas that where they practice it is the lack of the human touch. And we all know through medical school, you have to touch someone, you have to examine, and that was really the true definition of the art of medicine. Having said that, I think in a chronic care model where someone is making repetitive visits, the data shows that it actually works. And what does this say then? That if we embraced alternatives to patient care that could actually still ensure that our patients are getting the care they need and the physician contact, or doctor contact that they need, then that would be a step towards the right direction. But we have the infrastructure. I know during this pandemic, the Ministry of Health through following up the home-based care for COVID patients, they've been calling and having the patients who even have traveled to enter some data online as they keep track on, where it has been very effective because the patient is able to reach out to a healthcare provider. And that is short. This is on telemedicine in very ways, phone calls, or even having to fill on an online thing. But I think the one that I would really like us to push for and even think about as we move forward from where we are in different stages, from the active in clinical practice to academia to our senior colleagues on the other side. I think what we need to think about is a chronic care model that embraces telemedicine. And what do I mean when I say that? Like, I practice cardiovascular medicine, and when you see patients, like let's say with heart failure, and during this pandemic, you saw that the health-seeking behavior really changed for a lot of Kenyans. People are scared of going to hospitals because they thought we are the one with corona. And so they are scared of coming to us because they thought we will infect them with corona. So a lot of, as someone already earlier on alluded to, we lost a lot of patients to the non-communicable diseases, even bigger numbers, because they were lost to follow-up and they lost care, and some of them ran out of meds and they couldn't get their drugs. Institutions like where I work in Nairobi Hospital, they are doing some drug deliveries for patients at home. But now let's think about the 80% of Kenyans that don't have those luxuries. The one thing we could capitalize on is that the fact that a big population, and now this is where the youth come in, a big population of Kenya, statistics say up to 80% of Kenyans have phones. And actually they have phones that are smartphones. So we could actually utilize this the same way we say that you're going to do a video call on someone. Those could happen for patients, let's say in this pandemic, if we're to address now, patients with diabetes who are doing their sugar monitoring at home, and they need to speak to their healthcare provider because they've seen their sugar, maybe the control is not so good. Telemedicine is a very good solution. I'm doing this course with the University of South Wales about preventive cardiology. And one of the main units is about how to embrace telemedicine to take care of patients with chronic diseases. And this will range from cancer to cardiovascular diseases. But what about utilizing telemedicine during this pandemic? And I'm very glad that at least the government tried, the Ministry of Health, and through the advisory of our able team, Professor Anzala and the rest of the team in the task force, they embraced this part of having someone call in and say they're not feeling well. You have an access to a community health worker or a nurse or a doctor if you need one. But I think moving forward, we need to change, as we said, we need to integrate our health systems, do a complete overhaul of the things that are not working or were just rotten and we never spoke about them, and embrace new innovative ways. And you are the innovators, you're the young ones, and you're the ones who should come in with that spirit and that zeal to actually change how we practice medicine to make sure we give our patients the best care. And yes, we can do it. And you have the perfect mind of utilizing social media to even drive change. And even during this pandemic, I really, really will encourage all of you to embrace the use of social media. All the time you use on Instagram, posting photos of yourself, you could actually be posting some positive information that is correct, scientifically verified information on social media around this pandemic, so that we can debunk a lot of the things that are out there and ensure that we contribute positively to containing this pandemic and containing all the other non-communicable diseases. Thank you.
Absolutely, absolutely. Thank you so much. Thank you so much for that, Dr. Ubri. Dr. Mary Claire?
Thanks, Hamza, and thanks, Dr. Ubrin, for such a thought-evoking prelude. For me, I think telemedicine is now the future of healthcare, and the COVID pandemic has definitely highlighted that for us. As I mentioned earlier, we have innovations that have come up. We have Wheels for Life, which is really changing the maternal healthcare sector. We also have some of the mental health institutions have also been offering telehealth virtual counseling for people who need to talk to someone. Centers like Chiromolin have a number you can talk to. We have organizations like Mental 360 that have a WhatsApp number where you can just book an appointment to talk to a psychologist. So the COVID-19 pandemic has really given us something, food for thought. And I think as we talk about telemedicine, the youth are the future, but the ball is also in the court in the medical curriculum sector, because in medical curriculum we don't have a lot emphasized on telemedicine or even pandemic preparedness as such. And with this pandemic, we should now, I think now is the time we should start thinking of teaching additional units on the same, even matters to do with economics of health. We do learn them briefly, but with this pandemic, we now see how it's more relevant and more applicable in our setups. So yeah, I think those are just generally my views on the topic.
All right, thank you. Thank you so much for that. On to our next question. Many countries report developing antiviral drugs and vaccines to control COVID-19. More recent news has shown promising results in the release of the first ever COVID vaccine. However, vaccines may just not be the main intervention in developing countries. What are your thoughts on the availability of vaccines in developing countries? And once available, how will the vaccine bend the infection curve? I'd like to ask Professor Nzala to share his views on that, please.
Thank you, Hamza. Just to go back a little bit about telemedicine, and to say that we have used telemedicine at CAVI, where I work as a researcher, where I was as the first director, to really follow our patients. And it worked very, very well. For example, we carried out an Ebola vaccine trial. Many people might not know that the Ebola vaccine that is now undergoing licensure and the one that is being used in Congo and Western Uganda and in Rwanda, that phase 1 and phase 2 was actually done by us at the University of Nairobi. And we followed up patients just on phone in terms that the first follow-up was physical, second follow-up was physical, third follow-up, fifth, up to a year, we would actually just make a phone call and say, how are you feeling? Or fill in this form, because we would download, a form on their phone, and they would actually fill in. So for us, really, telemedicine follow-up is actually the way to go, and it's not much. The phone penetration in Kenya, surprisingly, is actually very high, and we can do these things even in Taita, where we have a research station, in Busia, where we have a research station. We are trying to follow up fevers of unknown origin through telemedicine, just to know in the last 1 week how many people came in with fever. What did you diagnose? Was it malaria? Was it salmonella? Was it? If it's unknown, then you begin to wonder. If you see an unprecedented increase in fevers of unknown origin, then that should raise a red flag to tell you rush there and begin to look at what is going on. So that is actually the way to go. And we hope that the kind of telemedicine we are talking about is where you analyze real data in real time. And that's the surveillance I'm actually talking about. And now coming to the issue of what will control this epidemic, we know very well that HIV, and I'll go back to HIV because we can draw parallels from HIV. HIV has been around for over 35 years. And HIV has treatment, no cure, but treatment. We have pre-exposure, we have post-exposure. We put individuals on treatment very early. There was a time we thought that we would treat ourselves out of this HIV/AIDS outbreak, and now we know we cannot treat ourselves out of this. Behavior change has been there, but as I've said before, we know we are creatures of habit. We can only change habit for a while, and then we go back to normal. I can tell you here and now that the usage of condom is at the lowest level, and that's why you are seeing a lot of all those teenage pregnancies out there. And when you see a pregnancy, that's an STI, and that could actually be a possibility that that HIV has also been transmitted. So we have a whole host of problems in terms of behavior and behavior change. So Hamza, from my point of view, we must get into pharmaceutical preventive measures. For me, what will stop the transmission of SARS-CoV-2 and COVID is actually a vaccine. Social distancing, you have seen the problems. Washing hands, you have seen the problem. Putting on masks, you have seen the problem. People put a mask halfway, all right? They put halfway. Even the other day when I was going home, I was sitting in the plane and the guy next to me was only covering the mouth. So I told him, Chief, cover your nose as well. So we have a problem there. So for us, really, the push is to get an intervention which does not need behavior modification. And the vaccine is actually going to be a game changer as far as COVID is concerned. A vaccine is also going to be a game changer, as far as HIV/AIDS is concerned. And I'm glad to say 2-3 months ago, those who have kept abreast with what is going on in polio must have noted that Africa was declared polio-free after a huge struggle. And the struggle was all around behavior change. We are declared polio-free, meaning that in the last 4 or 5 years, we've not had a real polio transmission on the African continent. So we begin with elimination. So we are in the elimination stage, then we move into eradication. So we are hoping that on the issues of diseases that are infections that have been eradicated, polio, smallpox went for good. We believe that maybe the next big one is going to be polio, and polio will go for good. So let us embrace vaccines. And as we do that, as healthcare professionals, we must then not be skeptics. I see a lot of skepticism about COVID vaccines. I see a lot of hesitancy about COVID vaccines. That is actually the wrong move. we must begin to discuss how we shall going to embrace COVID vaccines and general vaccines in general. We must also begin to address the issues of hesitancy. Why are you hesitant? What is the problem? And I would also like to mention here and now that for those of us in that field, we are moving away to only talking of childhood vaccines. We are now talking of vaccines among the adolescents, vaccines for adults, and vaccines for the elderly. We are living longer. We need to lead a healthy life. And now immunology has taught us that really after so many years, you need a booster. So for those of us who are 60 and above, we must be talking of a pneumococcal vaccine. For those who are joining colleges and places where you are going to be crowding, we must be talking of a meningococcal vaccine. So this is the direction we must take, and we must go back to basics, gentlemen, in terms of healthcare. And that basics is public health. We cannot be talking of a national health insurance fund that is waiting for people to get sick. We must invest in a national insurance fund that puts public health first. But if you are an insurer of health who is waiting for somebody to get cancer, you cannot pay for that 13-year-old to get a human papillomavirus vaccine. You are waiting for them to get cancer. Then that is a healthcare system that has collapsed. So as we discussed, we must go back to public health and ask, what is National Health Insurance Fund insuring for? And all these other insurance schemes, we must insure in public health. So Hamza, vaccines, as far as infections are concerned, vaccines are the way to go. The other aspects of it that we are not even talking about is the emergence of antibacterial resistance. You may die of a bacteria that was treatable 5 years ago. You know why? Because it has become resistant, and it is back to One Health. A lot of veterinary poultry farming using antibiotics, animal farming using antibiotics. Those eventually build up into the environment and begin to create antibacterial resistant traits. Again, One Health, we must go back to public health and ensure that we look at all the things that will prevent me from getting ill early so that I don't end up with chronic conditions. So vaccines really, and public health in general, things we can do, healthy living is actually what we should be advocating for. Thank you, and over.
Thank you so much for that, Prof. Definitely, there has been a lot of hesitance with vaccines, people having their own different opinions, that there were different speculations. Recently, I heard it and I was really surprised. People think there are microchips in the vaccine, and I'm listening to them and I'm like, really, guys, that's really not possible. But just highlighting upon the aspect of vaccines, the COVID vaccine, when it's out, what are your speculations? When will it arrive to Kenya? And secondly, will we require booster doses with it? How is the arrangement for it? Will you get one if you're infected, or do you do it for prevention? How is it?
Okay, there are on the issue of the COVID vaccine, there are certain unknowns that will actually evolve over time. The research and development has been completely unprecedented in the sense that a lot of phase 1 and phase 2 have been taking place concurrently, and then phase 2B, phase 3 has also been taking place concurrently. And the usual manner in which we want to follow a vaccine for almost a year to know whether it can actually give you protection for 1 year, that data is missing. And as you understand, Britain has already applied for emergency use authorization, so we shall know actually over time. So for now, we know that the effectiveness, the efficacy, not effectiveness, there's a difference between the effectiveness and efficacy. So now we know that efficacy is quite high. but that is limited because that was the first trigger. They are still following up 40,000. That trigger was only a calculation from 170, which is a very, very small sample size. But my prayer is that that efficacy holds. The challenge is going to be in the effectiveness. And effectiveness now brings in ability to produce enough dosage, but also ability to maintain cold chain in terms of logistics. That's the elephant in the room. And that's where the challenge will have actually come from. So definitely in the next, but I can predict here and now that by the first quarter of next year, around February, March, there should be vaccines in this country. If the worst, maybe the second quarter, but I can predict first quarter, towards the end of first quarter, February, March, there will actually be global vaccines being given in various countries. Kenya has already started working very, very hard. Division of Vaccines is looking at logistics, looking at who will be the first lot, who will be the first cohort, what is the criteria of the first cohort, will be the second cohort. They're looking at logistics and cold chain. These things are not easy. They are looking at the dossier. Will it be the Oxford vaccine or the Chinese vaccine or the Moderna vaccine? So all these things maybe are not preview to most of you, but all this information is actually, is actually ongoing, as we speak. So we are not left behind. We are there, but help us address the skeptics. Help us address the hesitancy, because when it comes, we want the only problem to be the logistics, and not that people are refusing to take the vaccine for one reason or the other. So far from what I've read, the Moderna, the mRNA vaccines from Pfizer and Moderna, the only major side effect we have had is fatigue, but that is fatigue that goes away over time. The other good thing is that Kenya is involved in the Chadok vaccine, the one from Oxford. This is being done in Kilifi. By now, they should have enrolled maybe 5 or 10 volunteers. So we shall actually know the safety profile of that particular vaccine in our own country. Over.
Thank you. Thank you so much for that, Professor Nzala. Before we continue, I'd like to recognize the presence of Dr. Amit Taka, who's the chairman of the Kenya Healthcare Federation. Thank you so much, Doc, for joining us today. I know you had a really busy schedule, and yeah, thank you so much for being here with us today.
Thank you. It's a pleasure, and I'm really learning a lot and enjoying from Professor Nzala's talk, and hope that will chime in. But thanks for having me on.
Thank you. Thank you so much. Doc, since you're with us here today and we've passed that question, I'd like to just go back and ask you, what have your experiences been like during this COVID pandemic?
I think the experience has been unprecedented, and I think the biggest experience has been collaboration. I think Kenya shines out as a global example, one of the global and continental examples of what it means to work together. I've never seen how public and private came together in the month of March, April, and May to quickly jump on a strategy that is made in Kenya, for Kenya, by Kenyans, using global knowledge, rather than just having a copy-paste approach. And I think that's been the success. Closing JKIA at the right time, managing to raise funds, repositioning our factories to have PPEs manufactured in Kenya. We didn't even have one PPE that we made. And I remember when COVID happened, there was really one machine that could do masks. And there was only one there, and they could produce in just hundreds per day. Look at what we're doing now. We are exporting. We are making PPEs to export. We started repositioning all our telemedical and digital health companies. We've registered over 74 new companies. So if you look at how private sector has responded through collaboration, I think we played an interesting role in keeping the numbers down in partnership with all the scientific input, as well as the coordinated approach. Of course, there have been glitches. Let me put it that way. And when you look back, and hindsight vision is 2020, there are so many things we could do better. The way we manage quarantine and management of that, we could have done so much better. The way we shut down the airport, we could have done so much better. The way we have done purchasing of commodities in KEMSA, we could have done so much better. And we learn from these mistakes. And there are certain people who will actually face the brunt of being absolutely non-compliant with the Kenyan laws. And that will make us a stronger country. We should not spare lessons learned, and we should celebrate our successes. So that's been our experience. And I think we're going to come out clear winners of a stronger health system in 2021, 22, and 23. Thanks.
Thank you. Thank you so much for that now. Definitely the collaboration between the public and the private sector really came to play. We never knew we could produce PPEs. We never knew we had the capacity. So that point that you brought up is a really important point. And yeah, thank you so much for that. So moving on to the future direction in pandemic preparedness. What are feasible mitigation strategies in a pandemic? I may begin with Professor Nzala, and then I can ask all the panelists to shed some light on that. Feasible mitigation strategies. Prof?
Hamza, I didn't hear that very well. You are asking something of me?
Yes, I was asking, what are the feasible mitigation strategies in a pandemic?
Actually, the best thing you can ever do in a pandemic is to be on top of things. What I can actually say in this country, that the ministry set us up very early. We got together as a task force very early. We put together the modeling team very early. We actually also told the ministry very, very clearly that this is unprecedented. So don't wait for outsiders, foreigners to start telling you this or the other. And no sooner than that, we had our first case. And all those travel restrictions, ensuring people are not coming in from Europe, closing down the airport, restricting travel from Nairobi, restricting travel from Mombasa. Those were all issues that we put together very quickly because we had actually realized that what had happened in Europe, in China, Europe, and eventually North America was nothing other than an infection that spreads through contact and close contact. And we had looked at other coronaviruses and also parallels from influenza. So the problem was the struggle internationally between the WHO and the masking, and also the struggle to be able to say this masking here in Kenya before even the WHO actually accepted that masking was part of the whole issue. So really, what we have now is those things: mask, social distance, and at the same time, ensure that you sanitize. And now the additional thing is, we now know that there are events we call super spreader events, weddings where you are too many people, because you cannot go to a wedding and not eat. And in the process of eating, you unmask. Funerals, parties, bars, transportation systems, where people are not masking properly, those are actually super spreader events. And we also know now, that from a COVID patient, it only takes 15 minutes within which the infection will actually settle within the nostrils. 15 minutes. We now know that majority of our patients are asymptomatic. So they have COVID, but they hardly ever show any signs of symptoms. And that is actually now the danger, because now COVID is not written on the face. So for me, really, The whole issue is that how do we go back to ensure that we behave the way we are behaving in July and August, where we were putting on masks, where we were avoiding all these events. But the worst bit has actually been crushed by our leaders. Reggae stopped, and then reggae started again. And when reggae started again, and I know you guys understand where I'm coming from. When reggae started again is when now things started going wrong. And you know, ladies and gentlemen, let us have no fear. Let us say the way it is. Colleagues have died. Our own colleagues in the healthcare system have died. Others have died even without being talked about. So many of us have been infected, only that we don't say. A lot of healthcare professionals have been infected. And the problem is that you have no insurance. When you get infected now as a healthcare professional, you have no insurance. You have to dig in your own pocket. Even if you survive with a big hole in terms of the economy. So my prayer is that wherever you are, let us appeal to our own at an individual level to stay away from super spreader events. Don't go home to the Western region, Nyanza, where Northeastern coast, if you don't really have to. Talk to your relative on phone. Internet penetration is now good. Wish them well, and let us protect ourselves from getting infected with COVID. I'm sure a vaccine is coming. I'm sure COVID will begin to go down. But for now, let us ensure that we don't get infected, because you don't know whether you'll end up being a mortality. But even if you're not a mortality, the social and economic impact saying that we lock down Nairobi, we lock down Mombasa, that is not going to help. You will lock down, but you still have to open. And what happens when you open? People begin to move. So really, let us appeal to individually. So let me stop here so that I don't take much time. But Hamza, that's where I come from. Thanks.
Thank you. Dr. Mora?
Thank you, Hamza, and the rest of the audience. For me, I'd like to retaliate and mention that this pandemic has opened up spaces that we never used to take seriously. And moving forward, just as the young people of this country, the young people in medicine, I just want to pose a challenge. I think it's all our responsibilities, as Prof. Nzala has mentioned, to make sure we educate the people around us, we educate our families, we educate the public where you can, in ways that you can. Utilize social media, it's a very powerful tool, and you guys have so much know-how about how it works. The other thing is just remember, as Prof has already alluded to this fact, that more health workers have gotten infected. We've lost a big number of our workforce. And remember, very few of us actually are in active clinical practice. So if one doctor serves a population of 45,000, that's the ratio, 1 is to 45,000, and you remove one, you're already dealing with a big number of a Kenyan population that will not have accessibility to care. But I'll encourage you as you're in training that this is time that we all remember that we live in developing country where still infectious diseases are still an issue. I think a lot of us, me included, are never very convinced to specialize in infectious disease. Now I think maybe I should have, but I'm glad I did internal medicine, and that already made sure that I know what
yes, sorry. Yeah.
And how to deal with them. And the other thing is, I just want to remind all of us that it's our public responsibility to make sure that this pandemic is contained. It is our public calling as Kenyans. And a lot of the members and my colleagues who are panelists here have contributed immensely into ensuring that we have the right strategy and all that. And I normally say that I am not a particularly big person, but if I make a small change in my small space, then my small change and your small change will amount to a big change. So always remember the wise words you've gotten from Prof. Anzala and the other panelists about what should be done, what kind of information you should take home, and make sure you pass that information. Anytime you see someone, and this one I keep on saying all the time, doing the wrong thing, like how people wear masks and going to public rallies and doing all those things, just educate your family members. If you educate your mother how to correctly don a mask and how to handle and dispose it, then you've educated your entire family, because she will educate the aunties, the sisters, and all that. And let's make the small changes we can in the small spaces, and let's be more involved in medicine and the politics of medicine, because there is no way they are not related, so that we can actually make an impactful change, as Prof has alluded. Thank you so much.
Thank you for that, Dr. Yubrin. I'd now like to ask Dr. Tucker, what are his views? Doc, you're on mute. You're on mute.
Oh yeah, thanks. Is your question about how we should prepare ourselves for the future?
Yeah, what if feasible strategies, mitigation strategies?
We've learned a lot. I would divide it into the three parts as follows. One is human resources and personnel. I would then go into the financing, and then I would like to end with partnerships. Let me just say that having this audience of medical students is great. I've been there. I've been through the same system, and I remember my times. The kind of people that we need in the health sector in Kenya need to be fit for purpose for tomorrow. The training in our academia must change, like it has changed for so many. And even in the companies that we run, there's always a change. So the kind of doctors that we see for tomorrow should be different from the doctors we saw yesterday. The nurses of tomorrow should be different of yesterday. The technology being embraced and the versatility of human resources for health in Kenya must be of a different standard. So the shout out to the training and the academia is the change must happen now. When my daughters go to school, I'm more concerned about who their lecturers and professors are, rather than the infrastructure and the residents and the halls of residence and the food that gets served. So it needs to be training, not only for human resources, but also the healthcare management professionals and the leadership that we see in the Senate, Parliament, Ministry of Health, CECs across the counties. That's going to be very important. So let me say people first, the right people. The second strategy is about the financing. We need to put the right incentives and regulatory mechanisms to have stronger and larger investments in healthcare. If people don't really see any future in the healthcare space, and there are too many barriers and too many costs, and it takes 160 days to get a dossier through maybe PPB, and it gives you huge amount of costs on licensing, people will stay away from investing in healthcare, and we will never be able to have a stronger health system, because half the team is private sector and half the team is public sector. It's only when two teams work together, you will actually produce health in Kenya. So if the ministry also has a full understanding that it's a 50-50 approach, because we don't have a Ministry of Public Health sector and we don't have a Ministry of Private Health sector. It's a single Ministry of Health. So that cohesion will be a strategic way to save lives and to save people and to have a stronger health system. And incentives for local manufacturing must be put in place, so we could see more factories rather than what we have now. We are importing 90% of the medications that we consume. And you can ask why. Ask any private sector, they will tell you that there are three policies that have not been passed that have not made them competitive. It's simple as that. If you look at also the remuneration that we give out sometimes to health workers, we need to align it so that it becomes appropriate and rewards should be given. So I think financing is a big area of discussion, We cannot be donor dependent all the time and waiting always for funds for PEPFAR money or the vaccines money and make us reliant for the outside. We should be self-sufficient and allocate more funds from the treasury towards healthcare expenses in our country. Of course, we need to use it efficiently. And finally, the third is, I think, partnership. I think the sector doesn't belong to any one person or any one individual. And the model of utilizing and leveraging the partnerships effectively, including global health institutions and local institutions and organizations, will actually accelerate our approach to SDGs. Sometimes when it is a silo approach, we don't seem to progress as fast as we can. So we want to avoid missed opportunities of a healthier country by ensuring that we have the right partnerships, leverage at the right space. To me, those are few ideas on the strategic intent for nation Kenya. Thanks.
Thank you. Thank you so much for that insight, Dr. Taka. I'd now like to ask Ms. Karijo, what are your views on that?
Thank you, Hamza. It seems we are all, sorry, can you hear an echo? Okay, but now it's over, great. It seems we're all thinking in the same line, which is really good. And I think for me, I'd like to say that the first line of defense should be strength when it comes to mitigating pandemics, because it's the human resources for health. So really ensuring that countries, that systems, and that all policy processes acknowledge that unless this first line of defense is really prepared to serve the communities and societies, then there's no way we can be saying that we are mitigating and stopping the spread of COVID-19. So ensuring that our healthcare workers have PPEs, ensuring that the health systems are ready, for isolation. It was really interesting to see that months into the pandemic, even the cases that were reported in Kenya, the counties were not even ready. They had to take months to actually set aside just about 300 beds for isolation. So really looking at strengthening our first line of defense, I think for me is a key priority. We have to mitigate pandemics, and then of course reducing cross-border transmission. And I know Prof talked about this earlier, the issue of travel. And I've always said that even if as Kenya, we have everything in place, we are shining, as was earlier said by Doc. If our neighboring countries are not doing well in terms of putting in place measures to control the spread of this pandemic, we can't say that we are doing well, because people are traveling almost every other day across these borders. So we have to acknowledge that interactions in countries and in our communities are really boundless. And so solutions have to be developed with this recognition and ensuring that this collaboration between countries, so that then we can reduce transmission across borders. We also have to acknowledge that solutions are not just to be done by governments. So governments cannot do everything alone. And I know Doc has talked about partnerships. We require a multi-stakeholder approach. We require a multi-sectoral approach to tackling the challenges of COVID-19 and to mitigating the spread of this pandemic. And of course, looking at who's making decisions, ensuring that it's not just policymakers alone, but citizens are also adequately included in making these decisions. The last thing that I want to touch on is on behavior change communication, because for the first time, people have actually come to acknowledge the essence of behavior change in any disease matter. Most times we're always looking at supply chain, we're always looking at the curative aspects of things, but behavior change communication has really come to the fore, and it should be prioritized. What was interesting, as we're working with young people throughout this period, we're actually taken aback by the fact that there are still many myths and misconceptions that exist when it comes to COVID-19. Are at risk of getting COVID-19, I can assure you, you'll hear the most outrageous responses, which is a sad situation, because many will tell you, I've not traveled, I'm still young, I don't have any predisposing factors, I'm not diabetic. So myths and misconceptions exist. And for us to be able to tackle this, we really need to invest in behavior change communication. So I think for me, those are my top priorities. Over.
Thank you. Thank you for that. On to Dr. Mary Claire.
For me, I think the wonderful panelists before me have said quite some really thought-provoking things. My view will be more or less to challenge the medical students because I'm a recent graduate. MSAKE, last I left, you were 5,500 members and you're in now 10 counties. So if you take it upon yourself to teach just your neighbor on behavior change, because if you look at something as simple as wearing a mask, especially in the rural areas, recently I bumped into someone who told me he doesn't think coronavirus is real. If you empower that one person and tell them the importance of wearing a mask, the importance of social distancing, then I think we might be one step closer in trying to improve our outcomes with regards to the COVID-19 pandemic. Another thing is also, yes, I alluded earlier that there needs to be probably a few amendments in how curriculum is. But right now, most of the information that we have is online. So during this time, I understand, yes, universities are not going, some universities are online, some are yet to resume. But if you have access to internet, uh, do something to empower yourselves. Right now, there are a number of courses that are coming up with regards to COVID-19. Take that short course, empower yourself, and then empower the people around you. And just by those small few steps, we might be able to create lasting behavior change and improve health outcomes as a country. Yeah. Thank you.
Thank you. Thank you so much for that. And yes, now more than ever, everything is on the online web space. You can get access to courses. You can connect with professors from Oxford, from Harvard, from any university that you like. So I think it all begins with the will. When you want to do something, you will find 100 solutions to do it. When you find 100 problems, you will not find any solution. So now that we're home, now that universities are not ongoing, let it begin from the medical students. Let it begin with us, my colleagues who are watching us. Let it begin from us. We can enroll for these courses. We equip ourselves with the knowledge, and this knowledge will help better society. Yeah, so yeah, thank you so much for that, Dr. Mary Claire. On to our next question. This is my favorite one. They say this world demands the qualities of youth, not a time of life, but a state of mind, a temper of the will, a quality of imagination, and a predominance of courage over timidity. To steer our next discussion, may I ask Ms. Evelyn to highlight upon the role of youth engagement in leadership and policy making in effective pandemic preparedness and response.
Thank you, Hamza. A really great quote. And I think we've all been emphasizing on this during this entire discussion, the fact that youth have to take on the mantle, that we have the power to really change what's happening at this time, even within, of course, the crisis that we're experiencing, but also in the broader healthcare system. So one of the things that I want to highlight is the need for policymakers and for young people to invest in these civic spaces that enable youth to be able to actually take on leadership roles and to contribute meaningfully to conversations that are happening. So we cannot have young people in leadership if these spaces are not available, but it's also an opportunity and a challenge to young people that we cannot sit back and wait for these opportunities to be given to us on a silver platter. We have to demand for what is ours. We have to demand for these spaces. We have to get a seat at the table. If we don't have a seat at the table, we create our own table, we is to be included in these policies. The second one that I want to mention is still on accountability. I know I talked about this briefly in the previous section, the fact that accountability is key if at all young people have to participate in the leadership conversation in ending COVID-19 and reducing the spread of COVID-19. But again, accountability can only happen where transparency exists. So if young people do not have access to these policies, if we don't know how the resources are being used, for example, we talked about KEMSA, we talked about PPEs. If there is no transparency, it's hard for accountability to happen because you cannot keep policymakers accountable for something that you don't know. So transparency has to be the first thing. Then accountability, meaning as young people, we need the skills and the capacities to be able to keep policymakers and even ourselves accountable to everything that's happening. Now, these are not skills that are taught in schools. I know earlier Doc talked about the curriculum. If you look at our education systems, you'll rarely see skills in accountability, in advocacy, in engaging policymakers being taught. So how do the youth, come out of the education systems and engage in policy processes? So as organizations, including WIAT that I lead, we are providing resources to young people on advocacy, on accountability, and I'll be sharing the links to our sites. The students, you can log on to that and get access to, free training on advocacy and accountability as well, just understanding the policy processes, understanding how to engage with decision makers so that we are not just looking at everything from a health perspective, a medical perspective, but also being able to really talk about the facts, policy processes. So I'll be sharing some of these resources. And lastly, of course, as young people, we also need to keep each other accountable. So it's not just keeping policymakers accountable, it's also keeping ourselves accountable to the things that we're supposed to do, ensuring that we participate actively in these policy processes. So those are my 2 key points. Over.
Thank you for that. Dr. Mary Claire, if you can shed some light on that.
Thank you so much, Hamza, and thank you for the fantastic prelude, Evelyn. For me, I'll start with saying this just off the bat, because I know some med students like saying they don't have time for anything other than med school. By virtue of you being a medical student, you're a leader in your own right. You will go out there and you will be a medical doctor. You'll be dealing with patients, you'll be handling situations. And many a times doctors are seen as more or less vital people in the community. So one is to first motivate med students who are watching and those who will probably catch this later, that you are leaders and you should not have any second doubts about that. Another key thing is that there's been a lot of development. There are very many youth organizations that are coming up. Even MSAKE right now, MSAKE has had tremendous growth over the past couple of years. Taking part in such activities, MSAKE does have avenues of advocacy and pushing for a change, especially in the medical student space. Find the standing committee that works for you, or find the area that works for you. Engage in such organizations and empower yourself to be a better leader. That's my first point. And then the second issue is with regards to basically, as I had alluded earlier about how our medical curriculum is set. I'll just repeat this again, that we need to have that will and that drive to make ourselves better and to empower ourselves. So yes, go online, learn something new, learn a new skill, and just gradually you'll find once you've at least gotten at least like the basic advocacy tips and tools, then engage now the leaders who are next to you, find a cause and push for it and go on forward. And yeah, that's basically it in a nutshell for me. Yeah.
Thank you for that. All right. On to our next question. What is the responsibility as medical students in pandemic preparedness and response? I'd like to ask Dr. Taka to tackle this.
I guess here you're asking about future pandemics and medical students, if I get your question correctly.
Yes.
Did I
Yes.
hear you?
The response, yeah.
Yeah, you know, like Mary Claire, and also we had Dr. Morad, Evelyn Kajiro talking about medical students being a leader, and Professor Anzala will also agree that you as students already have a huge influence on the community where you already are, and you can see many people talk to you, rely on you, and the reach for health workers in our country is limited. So doctors are limited, so medical students are also limited. So your role is behavior change. You are the scientific lead who have knowledge, and the communities you hail from and the friends who you interact with has a multiplier effect. I'm sure many of you have been called upon to be asked about, should I take the vaccine when it comes? And how you answer the question and how you defend it matters. When people ask you, should I wear masks? Should we still do social distancing? Should we get hygiene? How you answer this question and how you portray yourself has a huge influence and multiplier effect to the community, and that may save lots of lives. So not only in pandemic, but generally in the health ecosystem, medical students hold respect, but must be ambassadors, not only by speaking to the people, but also behaving and demonstrating this scientific behavior in leadership by example. The worst would be to see medical students congregating in super spreader type of events and actually participating in that. That would be wrong. Or medical students actually not following by the health protocols. So that's behavior change. The second thing I think medical students should do is push the envelope for evidence-based policies that you see. The voice of MSAKE in advocacy or having papers being sent out could be scaled up. And you've started this by doing such a webinar and having a huge movement of all the medical students from all the colleges would have been exciting. Would love to see, hundreds and hundreds of medical students logging in to share the views and pushing the envelope on science when it comes to what we need to do. So I think there are lots of roles of medical students, and also appreciating. You must also have an appreciative voice, not always a combative voice, on what the public sector and private sector are doing in this region, which you are trying to make MSAKE also develop its own partnership that Mary Claire, I remember, started last year. So I wish you the best. You have our support, and private sector will, partner with you and help you wherever you think we need to play a role.
Thank you. Thank you so much for that, Dr. Taka. I'd like to ask Professor Anzala to share some insight on that. Something small.
Yeah, just remind me again.
The responsibility as medical students in pandemic preparedness and response.
Yeah, you remember, Hamza, I told you a little bit that what I see going on in medical school, and it's a medical school I was trained, it's a medical school I know, is that there's disconnect of the medical training with the real world. So that there are students who, when they finish medical school, is when they reach the various public institutions and realize this is what they are. When I was going through medical school, we used to go for public health and actually stay in the counties and be there and see how a health center runs and be embedded into the process, so to actually understand what public health is at a very basic level. So we would stay there and be there for a month or so. These days, what I see is that students are taken in the morning and brought back in the evening. Number two, when I was in medical school, Around fourth year, because our year was 5 years, we used to go for, what is it called? Elective term. And most of us went to provincial hospitals, others to county hospitals, just to be there and they get embedded and actually see what it takes to be in a setting in the real world. I don't see that happening anymore. There is a very quick push to just be within the big healthcare facilities. And that's why when healthcare was devolved, we have a major problem in the county referral hospitals where you have a county referral hospitals, but you only have one surgeon. You have a county referral hospitals with renal, with the dialysis, but there's no nephrologist. So the whole issue is that what are you being trained for? That is a question we must ask ourselves. You are in medical school for what? For who? Who do you really want to serve? And if we don't ask ourselves these questions, then we are going to end up with a lot of problems, a lot of frustrated doctors, because all of you are either going to end up in Mombasa or Nairobi or Nakuru and be unemployed because your concept of hospital and being trained as a doctor was just one thing, to stay in the health, to stay in the big cities and compete for the little that is there, because the big cities, I can tell you, are actually beginning they are, getting overcrowded. So we must go back and just rethink why are we joining medical school, and that means going back to our career thinking and even beginning to talk to our own who are in high school and who are thinking of a medical profession. I'm not saying you have to work for free, but what I'm saying is that we must be able to understand why we are being trained as medical doctors and then begin to experience what goes on at the county referral hospital. Some of these hospitals are in very short supply of a lot of things, but then when you are posted there as an intern, it should not be the first time that you're experiencing that particular environment. So what we would like to do, and maybe that urge can come from the medical students themselves, can we begin to have a serious elective term where I don't know whether now it will be in fourth year or fifth year because of this change into 6 years. Number two, let's have serious public health where you actually experience what is going on at a public level. And then number three, I'd like us, all of us as doctors, to be in a position to inquire. Don't just say this is fever, it could be malaria, inquire. Be inquisitive, ask questions. Because when you hear our colleagues discover these and discover things outside there, it's not that they are different from us, but it's because they have a sense of inquiry. For them, just because somebody has malaria is not enough. Could they be having any other thing in addition to malaria? Nobody says that you cannot have malaria and dengue at the same time. And these things happen. But what I see is that because of lack of that elective experience, because of lack of that inquiry, we get satisfied with very little. So we want public health. We want to experience public health, not the issue of being taken in the morning and being brought in the evening, to be there and work with them. We want to go back to elective term and actually be in these referrals hospitals and actually see how these individuals are working. It is only that you can actually be able to say, this is not working, and we put our leaders on check. All right, we put our leaders on check. I can tell you here and now, there is a huge deficiency of doctors at the county level. But how do we change that? We can only change that from the grassroots. Accept to work in any part of the country. Join the union, speak through the union, because the union will listen to your concerns. And now that we can come together through the union, that is actually the place to put our grievances, because before then we never had a union. We worked very hard to have a union, and the government will actually listen. So Hamza, those are the issues. And then I was saying, again, in terms of research, let us begin to think of MD PhDs. Because again, we don't want all of us to just end up in clinical medicine. We want to have a divergence of some of us getting into research. We are trying to work a program where you come in as a medical student. In third or fourth years, you take a break. You begin a PhD program. So you end up with an MD PhD, which now gives you an opportunity to also be a researcher, regardless of whether you are in academia or in the public sector. So those are the things that I would like medical students to begin to think about and say, how do we bring this actually to bear? At any level, we must be asking ourselves a question. Let's just not be satisfied with one answer. If there is fever, there is malaria, what else? All right, what else? Could there be something else? How do we look for? And then going back to the basics. I cannot re-emphasize public health. Thank you.
Thank you so much for that, Professor Nzala. Due to time constraints, I will have to unfortunately skip some questions, but I'd love it if you can have another session and get the panelists, because this is a really informative session that we're having. But due to time constraints, I will have to skip a few questions, and we now move on to the last question. Recently, the Ministry of Health tweeted on the alarming increase of COVID cases within our country. Do you think that the current measures in place are sufficient to slow down the spread of disease, considering we are going into the festive period of Christmas, which involves a lot of gatherings and interactions? What could be done during this time to slow down spread, especially amongst young people who constitute about 2/3 of our population? I'd like to ask Dr. Ubrin to go first, please.
Thank you, Hamza, and thank you to the able panelists who really shed a lot of light and created a lot of conversation and food for thought for all of us. Addressing that question is, we know the curve on how infections are spread and pandemics run, and I think we've looked through those simulations and how things are anticipated to happen and when we'll get the peaks and all that. But what I'll remind all of us is what Prof. Nzala said earlier on about how behavior is such a big deal. And I know the reason why Hamza asked me this question is because we are moving into a festive season and people like to let loose and sort of enjoy. But really, we live in abnormal times and we have to really try and act appropriately to try and make sure that we don't see a surge in the number of infections. We anticipate that the numbers will rise because we also note that Kenyans have there's the inertia, public inertia, and also a lot of public mistrust around this pandemic. But we hope as ambassadors of health, as healthcare workers and providers, and even for you guys who are the students who are going to take up a lot of these positions in the next few years, if not months, I think what we need to do is just retaliate the same thing, that it's about a behavioral thing. We anticipated the numbers will go up, but at an individual level, as a student or as a mother, as a father, just reminding yourself that if you don't really have to go to those gatherings and all that, and Prof has mentioned about the areas where there's super spreaders and all that, if we avoid those places, we'll try and contain our numbers. But we know Kenyans, all we can do is to continue to do public sensitization at our different levels, nationally, individually, socially, family, religious gatherings and religious setups, even in WhatsApp groups. Please educate, educate, educate. Because if the numbers get more, we all know that our system already got overwhelmed at some point and we are just barely surviving, you know? So we can't handle anymore. We just need to take up our roles at our own individual levels and organizational levels to try and make sure that Kenyans are reminded. Regardless of that, I think it's nice to also acknowledge that a lot of Kenyans are trying. And I think, as we say, that there are other social determinants of health that need to be addressed by the government, addressed by the different areas like employment, if people have jobs, if they have money. But again, we've been told we need to brace for tough economic times. So we found ourselves where, as I said, we're in a situation where we know we need health to survive. We need to be healthy to survive. But that these other things around us that really, really need to be sorted out, right? From employment to education to all those things that we really know that play a big role in making sure that an individual is healthy or can seek or practice healthy habits or healthy lifestyles to try and keep away from this pandemic and other diseases that we witness. So Hamza, right there, really, I am crossing my fingers. I am doing my bit. Are you?
Thank you, thank you. I'm sure all our attendees can ask a question to themselves. Are you playing your part? Yeah, so now on to the last one, a general advice to our participants, a general talk. I'd like to ask Miss Evelyn to share her. Hello?
Hello, I can hear you, Hamza.
All right,
Thank
yes.
you. And I know time has really gone. So I just want to echo what everyone else has been saying. COVID-19 has disrupted our lives a lot, but the story isn't complete. We still have a chance to, edit this ending. There's a lot of hope with the prospects of the vaccines. As Prof mentioned, we're all excited to know that probably by mid next year, we should have things up and running. But of course, the vaccines only will not reverse the losses that we have experienced. The socioeconomic status of young people has really been affected. Our health has been affected, mental health. But all hope is not lost. We still have a lot that we can do to turn around things. And the young people and medical students, you have a big role to play in this. We've all emphasized the fact that you're at the fore of entire decision making, you're at the forefront of the health systems. So really stepping up your role, finding your niche, putting yourselves out there to lead and participate in every sector, not just in health, in policy making, in advocacy. Be there when it comes to governance. Advocate for what is rightly yours, for PPEs, for your colleagues, for a safe working environment, for stronger health systems. Keep policymakers accountable. Lobby for investments where, as medical students and as youth, you can engage with policymakers. So those are my brief remarks, but you all are a force to reckon with. So be confident, and I'm sure you'll make a big difference as we try to build back better. Over.
Thank you for that. Dr. Mary Claire?
So for me, my main closing remark will be what I said earlier. Medical students, you are leaders. Do not have doubt about that. And as you are a leader, be a leader that you want people to emulate. Lead by example. Start by empowering yourself, and then also then empower the communities around you. And that way, I hope also you'll continue being active in MSAKE, because it is offering wonderful opportunities with regards to advocacy and capacity building. Yeah, thank you.
Thank you so much for that. And now on to our last panelist, Professor Anzala.
Hamza.
Yes.
So, yeah, you want me to give the concluding remarks?
Please.
No, this is critical. This is important. And I think for me, COVID has brought us closer together than ever before. There are a lot of negatives about COVID, but there are a lot of positives. What I'd like to see is that can this forum continue? Can you organize more of these forums? Can we talk? Can we dialogue? Can we debate? Because this is the only way society gets better. Can we criticize each other? Can we learn from each other? This is the only way we are going to get better. So I'm going to be available because now I can talk to you even if I'm eating sugarcane in my Mumia's home. Okay, so I don't have to be in the medical school. I don't have to be in Nairobi. So let's encourage these forums. Let us dialogue. Let us talk. Let us debate. Let us look at the things we have said. And also the goodness is that We are now closer to the policymakers than we were before, actually. I can easily call my colleagues in the Parliamentary Health Select Committee for Health, organize a Zoom, and 70 to 80% of them will be there. So COVID has actually brought us together. So let us utilize this space for the benefit of all of us. And as we do this, the next forum you do, begin to actually bring in the CECs of health from the counties. Begin to involve CECs from the counties. The chief of the CECs of the health in the counties is actually a medical doctor from Makueni, somebody we know very well. So as we go ahead, bring in the CECs of health, bring in doctors from the county so that we can actually begin to hear the experience and say, what is it that we can actually do? Even in terms of training, bring in patients to also begin to hear what is the experience? What is it between a doctor now and a doctor before? Are there things that we are missing that we need to inject into our own training so that we have better, professionals? So for me, that will be my prayer, that we need to do that. But at the end of the day, again, just to say that it is sad to see that colleagues are dying. It is sad to see that colleagues are getting infected with COVID. But also what I want to appeal is that, as I said before, we are creatures of habit, but let us not get fatigued. COVID has not gone away. COVID is still with us. Even with the vaccine, it's going to take a while to ensure that we limit the spread of COVID. So let us just ensure that we are the brother's keeper, remind ourselves how to wear a mask and wear it properly and consistently, avoid spreader events, but talk to your colleagues about all these things so that they hear from the person who cares and loves them. So for me, I'm committed to joining you at any time, even at short notice, just to share and ensure that we enrich our profession. I like what I do. I enjoy being in this profession. And I don't think that looking back that I would go for any other, profession. So I'm ready to give as much as I can. Thank you very much.
Thank you so much, Prof. And definitely, we wouldn't want you to go and do something else because all the findings, you have played a major role in that, and we thank you for that. You have been a really instrumental figure, especially within the university. That's where we are, and that's where I've interacted with you. And kudos to you, Doc. Professor Anzala, for that. Okay. As we've reached the end, I'd really take this opportunity to thank our vibrant panelists for that interactive and informative session. There has been a lot of information that has been exchanged. There's a lot of thoughts, lots of views shared amongst us. And for that, I and our whole organizing committee is really grateful for the panelists who have come on board. I know we've been following up here and there for your photos, for the bios and all that. But from the bottom of our heart, we really thank you for joining us here today, and to our attendees who have joined us today. Thank you so much. For it wasn't for you, this session wouldn't be a success of its magnitude that it is. Yes, so from all of us here from the organizing committee of the MSAKE GA 2020, we thank you all very much for joining in, and we look forward to hosting more sessions. Thank you very much. Just a last thing, if you can all kindly switch on your webcam so we can take a snapshot that will be used for our magazine, please. Yes. Can I ask the participants? Okay, guys, I'm really sorry. Participants may really not be able to. Yeah. Prof, if you can take, switch on your camera.
Yes.
Yes, Gagan, if you can also switch on your camera, and Nicholas. Nicholas?
So, Evelyn, Maria, you enjoy your Christmas season, but stay safe. Okay,
Yes.
please stay safe, all of you. I want you guys alive and well. Hamza,
Yes.
communicate
Prof.
to everybody. And it's lovely seeing you on the panelist, and let's continue debating and dialogue and staying together so we improve our healthcare system.
For
Thank
sure.
you.
Thank you, Prof. Thank you.
Thank you, Prof.
Thank you. Bye-bye.
Thank you, Professor.
everybody.
Thank you, Dr.
Yeah.
Yubrin, Dr. Evelyn, Dr.
Thank
Mary
you,
Claire,
everyone.
Professor Anzala.
Yeah.
Thank you very
Okay.
much.
Bye-bye.
Have a good weekend. Thank
Okay,
you.
same to you.
Bye.
Bye.
Bye. Thank you, panelists. Sorry, not panelists, participants. Thank you all for joining, and we look forward to hosting you on our other sessions. You can be following on the MSAKE group. We have a WhatsApp group on which you can get information on our next sessions. We'll be having our abstract presentations tomorrow. So yes, feel free to join in, tell your colleagues, and we look forward to hosting you